Hello, I'm Naomi. I'm a respiratory nurse. I'm going to show you how to use your press and spray inhaler with the HalerEase device. HalerEase is designed to make it easier for you to use your inhaler if you have reduced hand strength or if you find hand movements difficult. It uses a simple lever system that reduces the force needed to press your inhaler. This gives you smoother control and a more comfortable experience. It's important that you always follow the advice given to you by your healthcare professional about your inhaler technique and your treatment. Let's get started. Step 1. Check your device and inhaler. Before you begin, make sure your inhaler and your HalerEase device are clean and dry. If your inhaler has a dose counter, check that it's full. Check that your inhaler is compatible with HalerEase. You can cite or you can ask your GP, nurse, or pharmacist. Step 2. Attach your inhaler. Hold your HalerEase device in one hand. With your other hand, insert the inhaler into the holder. You can pull the lever at the back of the device to make this easier if you need to. Push down until you hear a click. You'll know it's on properly when it feels secure. If you find this tricky to do, ask a friend or relative or take it to your healthcare professional or pharmacist. Step 3. Get ready to use it. Once your inhaler is attached, shake it as you normally would before taking a dose. Keep the HalerEase upright and ready for inhalation. If you use a spacer device, attach it now. If your inhaler needs a spray to prime it, follow the instructions that came with your inhaler. Step 4. Use your HalerEase. Breathe out gently and slowly through your mouth away from the inhaler and spacer until your lungs feel empty and you feel ready to breathe in. Put the mouthpiece in your mouth and close your lips around it to form a good seal. When you're ready to take your dose, squeeze the lever with one hand or both hands until you hear the inhaler release one puff. Breathe in slowly and steadily until your lungs feel full. Take the mouthpiece of the spacer out of your mouth and with your lips closed, hold your breath for up to 10 seconds or for as long as you comfortably can. Then breathe out gently. Step 5. After use and removal. You can leave your inhaler securely fitted inside the HalerEase device in between uses. When it's time to clean or replace your inhaler, hold the device firmly and twist the inhaler gently to release it from the holder. Try not to pull or bend the inhaler as you remove it. Store your HalerEase in a clean and dry place away from heat and direct sunlight. You can wipe your HalerEase with a clean dry cloth if needed, but don't use harsh cleaning products. Important safety information. HalerEase is not a medical inhaler or a medicine. If you notice any difficulty when attaching or using your inhaler, or if your inhaler seems damaged, stop using the device and speak with your healthcare professional or pharmacist. Thank you for watching. For more information, including a full list of compatible inhalers and care instructions, visit the HalerEase website. If you have any questions about your lung condition or your inhaler technique, speak with your pharmacist, nurse, or GP. Always follow the advice given to you by your healthcare professional about your inhaler technique and treatment.